Okay,
Yes,
so
it is done. Yes.
we need to understand this topic because we need to find a relevant citation. What is that relevant citation? Relevant citation depends on your purpose, why you are searching. If you are searching for a case tomorrow, which you have in your clinic or in your hospital, the relevant citation would probably be a meta-analysis. If you have a library dissertation and you want to search for topics, guide has asked you to search for the topics, then probably you would be doing a more general search. Then you would be searching for a review. If your purpose is to actually find something interesting in relation to a specific area under study, you might even read a case report. So what is relevant to you depends on your purpose. Whether you are using this search for which purpose, right? So you should be clear about your purpose before you decide how are you searching. The dental literature is very, very vast now. It is growing very fast. And through my PubMed search, I have created this graph. As you can see, there's a huge surge in literature. First, I will go to Google search as such. I tell you a little bit about that before we move on to PubMed. So I'm just opening Google Chrome page now. And I'm just clicking Google. So if I say dental photography, I hope the search engine is visible to you. Okay. If it is
Yes,
not, please
no, it is
interrupt me.
It is visible, Dr. Ravi.
Yes, ma'am. Thank you, ma'am. So I have searched for this term dental photography here. And if you see, a lot of things come up. Some of them are actually, this one now where the cursor is moving. It's an article in PubMed. But if you see the next one, this is, looks like some commercial, website. If you slightly move ahead and see, you might even get a proper commercial website, which dental economics, you can see. So when you search in Google, the basic problem is a lot of scientific literature is mixed with a lot of lay literature. As a PG student, you would want to search in the scientific literature and not in the lay literature. Okay, or not in the literature which is accessed by rest of the people, non-technical people. So you don't want to be searching in Google whenever you are searching for a specific topic which is related to your dissertation or clinic, but you would still use a Google search for certain things. One of the things for which you will use a Google search would be to search a book, right? So if dental photography is there, you want to search a book, you can see I have clicked on more here and I have a lot of options available here. I click on books. You can see now all the books with the title dental photography are in my results. So whenever you are searching for very something which is very common, like a book, you may use Google search. Also, you would be using Google search when you are searching for an image. Now I clicked on an image, and I'll just give you only one tip over here. I know there are so many things here which you can learn of Google search, but one very important thing which I will tell you today is about how to use the tools. If you see, I don't know how many of you have used this thing called tools. My cursor is moving there. If you see there, tools, I click on that. And now there are some other things which have now opened in the menu there. You can see that over there. And one of the tools which is very useful for you as a PG student would be, let us say you are searching for an image and you want to use it in your poster. and that poster is being displayed in not just in your institute, but also it will be a part of a conference proceeding. Okay, so when such a thing is there, when it is not for personal use, when you want to use an image for a presentation for broadcasting, or you are making a health education video and you want to use a image that is not copyrighted. So when such a thing is required for you, then you can go to this particular subsection in tools called as usage rights. Okay, and in that usage rights, you have Creative Commons licenses, Creative Commons and other licenses. Creative Commons is material which has been given for open access and which has been rendered in such a way that there is no copyright issues over there. Anyone can copy it and use it. So if you are using any image for a public broadcast, then you would probably go for a Creative Commons license, right? So you can see all these images now. These are all from Creative Commons license. So if you are making, let us say, a board for your clinic, or you are making a poster for public display or a video presentation, you would want to use something from a Creative Commons license, because then nobody will question you why you have violated my copyright, why you have copied my image. So this is one thing which as a PG student you should be aware of whenever you are using a image. Another important Google search thing that will be for you. Let us say you are making a poster, and we know when we make a poster, it's a digital poster or it might be an actual physical poster that you will print. Especially if it is a poster that you will want to print, then you want images of large size, right? So that option is also available in this tool, size, large size image. Now what I am asking the Google is to give me large size images on this particular topic, which are Creative Commons licenses, which I can easily use. These are all free images, right? You can see everywhere. They are all free images. Some of these may not entirely open, like let us say if it is a commercial website, they might display that and then say, okay, you will have to pay so much money in order to take that particular image. Okay, so this is one thing which I wanted to show you in Google. Other than this, there is not much use of Google, because as we discussed earlier, Google is a very general search engine and it's not going to give you scholarly material. Google itself has come out with a website called Google Scholar. You can see now I am opening the Google Scholar. This Google Scholar is useful for certain specific things. Google Scholar would be useful if you are searching for something which is not actually a printed material in a journal, or it is not a part of a peer-reviewed manuscript. For example, you are searching for a dissertation. So many times dissertations are submitted to university. University has its own repository in the website, and not all these dissertations actually come out as a publication. Okay, so if you want to search for a dissertation, Google Scholar would be a good place to search. If you are searching for a conference proceeding, conference proceedings are sometimes published in a journal, sometimes they are not published in a journal, they are just available in a conference website. So when such information is being searched, you could use Google Scholar. Of course, Google Scholar has other advantages about which again I am not going to discuss today because this is an introductory lecture. Google Scholar, please use it only when you want to search such type of literature. Non-published literature, not from a publisher. Google Scholar will give you a lot of literature from universities, and other government websites and such repositories. Okay, so when you want to search something which is non-peer reviewed and non-published literature or published only in internet, then you would search for a Google Scholar. But today's topic that we are talking about today is not about Google Scholar, neither about Google. There are advantages for Google Scholar. Advantage is when you can search for preprint archives, conference proceedings, research documents collected and preserved by libraries, but not controlled by commercial publishers. If you want to access the James Lind's article of 1700s, you can search in Google Scholar, right? Or if you want to search for a very old book like Gray's Anatomy, you can search in Google Scholar. But or you want to search for a patent, again you could use the Google Scholar and search. So, but Google Scholar is not good for many reasons. One reason it's not so good compared to PubMed is that it does not have any option for sorting the results. It does not have any option for filtering the results. It does not have any option for systematically storing your relevant search results. It does not also have a controlled vocabulary. When I am telling the disadvantages, I am telling with one purpose. The purpose is that PubMed has all these things. Do you know that PubMed has all these things? PubMed has an option for sorting. PubMed has an option for filtering. PubMed has an option for systematically storing your results. PubMed has a controlled vocabulary of dictionary. And if you use with that particular method, we call it as mesh searching, your search becomes much better. So these are the disadvantages of Google Scholar. See, if you are searching for an article from a published journal, please don't use Google Scholar. So we will right away come to the topic. Successful PubMed search. I usually conduct this as a hands-on. If you have a mobile available with you, another mobile on which you are not accessing this presentation, simultaneously as I do these things, you could search. Or if you have a laptop available adjacent to you, you could now log in and start searching the way I am doing here.
I think it is possible for most of them, Dr. Ravi.
It is possible, then they could do it, ma'am.
Yes, they can.
Okay. So first we will see in the demonstration the best match sorting, article types, and signing into MyNCBI. So first, sorting by article, filtering by, first one, the best match option. When you search in Google, when you search in PubMed, I'll go to PubMed. So I have opened the PubMed search engine now. Recently, the PubMed search engine homepage has very much changed. You can see nothing available over here except, the term which you need to type and search. For example, let me say post and tour, and I'm clicking on search. And when you see, I have got 17,000 articles on post and core. And you can also see that there are sections over here on the left hand side of your screen. You might see there are some sections and subsections over there. These are the filters. Okay. If you see which article has come up first, it is not 2020 article, it is 2017's article which has come up first. So PubMed by default now has the best match option. You can see this is sorted by best match, but you can sort it otherwise. You can change the way in which the PubMed has sorted differently. My cursor is moving there. The PubMed is sorted by best match, but I can change the display options. So I could change the display option instead of best match, let us say, to most recent. So now please note what was there the first article, Journal of Advanced Prosthodontics 2017 article was the first one. Now if I change it to most recent, now the same 17,649 results, but the first article is 2020 article November 7th. Okay, just 2 days back this article has been published. In fact, this is online out of print, right? So if you want to read something very latest, then you would change the sort option by most recent, right? But the best would be to use the best match. You could also sort it by journal, right? You could also sort it by first author. It will arrange in the alphabetical order of the authors. So various other sortings are available, but the one which you would by default use and is very useful is best match option. Okay. Having said that, I will also show you the filters now. There are filters available in PubMed on the left hand side of your screen. You can see that the filters available which are right now displayed are text availability. For example, out of these 17,649 articles, we don't know how many are free full text or how many have the link to free full text. If you want to know that, now we can click on this. You can see the checkbox there, and if you click on the checkbox, automatically the filter has been applied. You can see the free full text filter has been applied, and now earlier 7,000 some number articles were there. Now it has reduced to 6,887. 1,000 articles which are not free full text now have been removed from the search result. You could further increase this filter. For example, you are searching for this topic of post and core, let us say as a library dissertation topic. I just want to read in general about this topic. Then you probably would click on review. Now I have clicked on review in article type. Now I have 602 reviews. All of them are on post and core. You can see the first one, post and core buildup, melasma and post-inflammatory hyperpigmentation. This is not on post and core. The second article which you see is not on post and core. Why that happened then? What was the problem in the second search was that the word post and the word core, you can see that in the abstract. Non-core is a word used there, and post-inflammatory hyperpigmentation is a word used there. So the word post and the word core are picked up, and this article has come up, the second article. Okay, so this is just to show you that PubMed search is not perfect. The moment you put the word post and the core, it's not going to search for the concept of post and core. It is only searching for the word post, the word core in the article, and it's going to give you the results. Okay, so that's how you have got your results now, and you could further filter these results. For example, now this particular article of second article was not relevant, but it has come to your search result. So in order to reduce such unnecessary articles, we could set up additional filters. You can see on the screen now, my cursor is moving where I am pointing you towards the additional filters. So I have clicked on additional filters now, and various additional filters are available. One is article type, other is species, human or animal. If you are doing animal research, this will be very useful filter. Language filter, there are so many times when we search, we get a lot of articles from other specialties, especially for some subtopics, right? So you could click on an English filter, you will be getting only articles that are in English. I have clicked that now, and I have asked it to show. Now this English language filter has come up in my home page. Okay, so like that you could set up additional filters on gender, on subject. For example, some subjects, you could click on dental journals. Okay, now I have clicked on dental journal and I have asked it to show. You can see the dental journal filter over here. Okay, so now for the topic post and core, obviously you want to be reading from a dental journal because it's a core dentistry topic. So out of these 602 reviews which are having the term post and core, I would see how many are there as English article in dental journal. You can see 602 results were there. Just remember that number. And then English and dental journals. I will be clicking on dental journals now. You can see that all those filters have been activated now. Now how many? From 600 articles, we have zeroed in on just 21 results. Can you see? Here, my cursor is moving there. On post and core, now we have got 21 articles, which are all free full text, which are all reviews, which are all written in English, and which are all published in dental journals. See, where is 600 and where is 21? There is a huge reduction in the number of articles that you will need to skim through just by using these filters. Okay, so these filters are very, very useful, and unfortunate part of this use of these filters is that every time you have to check and uncheck those filters. Okay, right now these filters have been applied. If you want To remove these filters, you can remove these filters, but you always have to check and uncheck these filters. For example, now 21 articles are there, which are all free full text. But you say, okay, I have a good library, even if they are not free full text on the internet, I can access that particular text from the library. You could simply uncheck the free full text. Now from 21 results, the results have now gone to 196 articles. Okay, 21 articles were free full text, but rest of these 100 articles, or more than 100, 150 articles, are not free full text. If you click on the link, you will not get the full text article, but you could go to the library and access that particular article. So based on what was the purpose of your search, you could modify how much of results will be displayed in your home page. Okay, so please use the filters wisely. As I told you, the unfortunate component of these filters is you have to check and uncheck multiple times, right? So that's something which you don't want to be doing as a PG student. You don't want to be wasting time, on something which is repetitive. So if you don't want to do that, then I have a tip for you. I have a suggestion for you. That suggestion is my third objective for this presentation. We have already seen how to sort by best match, which is a default option. You could also change it to most recent. We have also seen how do we filter. Out of all the filters, I showed you the article type filter. That is the most useful filter because it will set your purpose. The third objective, which I thought I will tell you now, was to sign into NCBI so that you can manage your filters. Okay, so let me show you now the home page again and show you how it changes if I can sign in. You can see on the left hand side of the screen are the filters available. Just remember that particular thing in your mind. I'm going to log in now. Okay, so various accounts are available. You could create your account. Okay. I have just repeated the search now, post and core. And I have logged in. Okay, how to log in, how to create a username, password, all those things are very simple things for you. You are the digital generation. You will know how to do it. You can see that I have logged in over here, right? You can see my name over there. That's my name. And you can see that now the filters which I have set up are displayed over here. So every time you don't have to check and uncheck these filters if you log in into your MyNCBI account, right? So you can see that out of these 17,000 articles which were related to post and core, I know that free full text are 6,887. You remember last time we had put the free full text and we had got this number, right? I also know that there are 7 of them are practical guidelines. I know that 1,500 are reviews. I know that 613 are free reviews. Okay. I know that 611 articles are published from India. Okay. So whatever filters, like even I had a presentation earlier in Dhule. So I have put that filter of Dhule. Like I was earlier working in a college, another institute. So I have put that name of that institute. So basically this I'm demonstrating so that any filter you can set it up over there and that will filter your articles based on that. Now you don't have to check and uncheck on these filters. These filters are available. You know how many practice guidelines are available on this. You can simply click on this and you could get now these are 7 practice guidelines. Unfortunately, these are all postprandial hyperglycemia, post resuscitation, right? So they are not on post and core, but they have come up over here because the word post and the word core was there. That problem will always be there. I will tell you how to sort out that problem a little while later. But as of now, these are the 7 practice guidelines which have come up for the words post and core, not for the topic post and core, for the words post and core. Okay. Um, so that's it. That's about the first part of my presentation. So please filter by article types. You could read a review if you want to, just know overview or a summary of a topic. You could read a case report if you want to read a rare, new, interesting case on a topic. You could filter by clinical trial if you want to see the effectiveness of a therapy and tomorrow your case is there. You could read for, for practice guideline if you are searching for academic bodies recommendation on that particular topic. So remember that filter continues to be active until you uncheck it. And please explore all these text availability options, journal categories options, language filters, various filters. They'll be very useful for you. And for each filter that you set up, you will save a lot of time in going through rest of the pages. When the display pages comes like 7,000 articles, hardly there is any student who will go to the last, till the last page of that search result and search an article, right? So you will always want to reduce the total number of articles in your home page. I would recommend that you should not be searching more than 5 pages, or about 50 articles, 50, 60 articles. You will be able to read. Beyond that, if 600, 6,000 like that articles come, then you will not be able to, you will miss some good article, which is there maybe at the page number 13 or page number 25 of the PubMed page. So please use the filters effectively so that you can do a good search. Add a free full text filter to your MyNCBI, okay, so that every time you don't have to check how many free full text articles are there. You can customize your filter to Pune. You can add the Pune to your filter, and then you will get all the articles which are published by people from Pune, from whichever institutions are there. So advantage of putting these filters which you have customized. Now in Pune, you know who is working on post and core. You can contact that person from maybe some other professor from some other institute. You could request, you could call them, you can talk to them, and you'll be able to personally meet them, and you will be able to access their articles or get an idea of what they are doing, right? So you could customize your filters accordingly. So let us do this again now. If you are doing it, search for dental implant and see what happens to the filter. I am now going back here. I'll remove post and core. I'll put dental implant and as searched here. So now I know that on dental implant there are 49,000 articles. You can see that result. Out of that, dental implant placed in children is 2,600. 8,000 of them out of these 50,000, 8,000 of them are free full text. I know that 1,900 are randomized control trials. Okay, so like this, whichever, and I know that 1,500 are articles written from India. 959 are meta-analysis. So I know exactly how many breakup of these 50,000 articles are there by setting up my filter. Okay, so that's about the first 3 objectives for my presentation. So before we move ahead, we could have one question and then we can move ahead. If there is a question, I'll just wait for a minute. If there is a question, we will take it. Otherwise, we'll move ahead. If there is a question, please unmute yourself and ask the question.
I think questions will arise tomorrow. I think they need to do some homework today since they're just first MBA students.
Sure.
Based on what they've learned in 1 hour today, they need to do the homework. I'm sure most of the guides have discussed the topics, the term dissertation 1 or the dissertation with you all. So you could do the searching based on what has been taught today. And I guess tomorrow they'll have more questions, Dr. Ravi. That's
Sure,
what I understand.
Sure, ma'am. I'll go ahead, ma'am. Okay, so till now we have seen only the filters and the display options. We will use some more options available in PubMed to make our search effective. One objective for me for this presentation was that you learn how to use the clipboard. It's a very useful option. So I will just demonstrate that to you. You also learn how to explore the related citations and change the display format when needed. Okay. So these three objectives I am going to take it up now: clipboard, related citations, and display format. And for an example, we will search for an article related to antibiotics in acute pericoronitis. We will search for an article. So let us say I have a seminar on, or I have a case discussion. Tomorrow there is a case coming up. There is a pericoronitis case, and then I am required to decide whether I need to prescribe antibiotics or not. And my teacher has asked me to search for this in the PubMed and get good articles. So that's my objective now. I want to search for antibiotics in acute pericoronitis, good articles, and I want to show it to my guide. So I'll go to the PubMed now. Okay, so the topic which I want to search is antibiotics. In acute okay, antibiotics in acute pericoronitis. Technically, yeah, the word "in" used here is of no use actually. These are called as stop words. They are not processed in the search. So you could as well delete this. Antibiotics, acute pericoronitis. The moment I put a space between any two words, those words are added together. For example, if I put antibiotics, acute pericoronitis, it's going to search me articles which have all these three terms. If an article has all of these three terms, it's going to come up in my search page. So I have clicked on antibiotics, acute pericoronitis. And I have got 39 results now, 39 articles. And what I will do is, I will want to now again see my purpose. If I'm a pedo PG, then I will directly go to my all child filter, right? So that would be my goal. If I want to do something tomorrow with this prescription, first thing I would want to be searching is a practice guideline. Okay, this all we have seen in the last discussion. But what I wanted to show you over here is the use of the clipboard. Now these 39 articles are there. Let us say I am a pedo PG, so just to reduce some number of articles here, I have clicked on all child filter. You can see that there are 11 articles related to acute pericoronitis and the child filter over here. So obviously, most common reason why we would get pericoronitis would probably be the third molar, which wouldn't be in the range of childhood. So you get all the exceptional articles now. Non-third molar related pericoronitis in suburban Nigerian population children. You can see such an exceptional article you have got because I have activated a all-child filter. Investigation of infectious organisms causing pericoronitis of mandibular, third molar, and then things like that. So you can see acute pericoronitis is the term which I was searching, but what I am getting here, non-third molar related pericoronitis, then some article here, non-acute pericoronitis. Why did I get that? Because I had put activated the child filter, and specifically having articles in children related to pericoronitis would be very rare, right? Because of the age restriction, and pericoronitis commonly happening in adults. So that happened there. So I'll uncheck this filter and I will just go for all 39 articles. Okay. Now, let us say I have certain articles which are liked. Basically, I wanted to show you how to use the clipboard. So let us say first article, an insight into acute pericoronitis and the need for evidence-based standard of care. It looks like a good article to me. So I click on the checkbox on the left-hand side over here. You can see the PubMed is telling me that this one item has been selected now. Differential diagnosis and treatment proposal for acute endodontic infection. The second article does not seem to be so much related to my topic, right? At least by reading the title. Right now I am filtering only by the title. You could also filter by reading the abstract, but right now I am not doing that, just for the purpose of demonstration. Okay, so I will not select the second article. The third one, antibiotic prescribing for orofacial infections in pediatric outpatient, a review. Okay, so this is a pediatric outpatient. So I wouldn't expect probably acute pericoronitis cases over here. So I don't want to be reading this article. Okay, third one also I will neglect. Fourth one, non-third molar related pericoronitis in suburban Nigeria. We found this article earlier, right? So again, this is not so much related because this is non-third molar related. I am interested in third molar related. So again, I leave this. Okay, the fifth one, British oral and maxillofacial surgeon's view on etiology and management of acute pericoronitis. Okay, that looks good. So I click on this. So like this, so why I'm trying to tell like this is, of course you will do this based on your purpose. Why I'm trying to demonstrate like this is, not all articles that come up in your search page are relevant. Just by reading the title, you know they are not relevant. So you don't want to be, mixing all of them with articles which are relevant. So you want to be picking up the articles which are relevant at a separate place. So that is the clipboard for, right? So I have clicked the second one now. You can see the checkbox. The second one is clicked. The third molar infections, it looks good. I'm just going to do till 10th article, okay? You may go for more, but I'm just for demonstration purposes, I'm going to do till 10th article. Next one, seventh one, fatal complication in patient with severe multiple space infections in oral and maxillofacial head and neck regions, a case report. Looks interesting, may not be related to pericoronitis, but I want to read the abstract before I decide, so I click on that checkbox. Seventh one, antibiotic prescription in emergency dental service, a retrospective cohort study. Not so relevant, they have not used the word pericoronitis, so I am not clicking that article. Ninth one, metronidazole in the treatment of severe acute pericoronitis. Very, very useful because I want to read a article on pericoronitis. That's useful. 10th one, study of antibiotic prescribing among dental practitioners. And I'm not finding the word pericoronitis there, so I'm ignoring this particular 10th also. Anyway, so I clicked on 9th one, 7th one, 6th one, 5th one, and the first one. So these articles now, I feel they are interesting by title. I want to now read by abstract. So what I will do, I will use the send to option in the clipboard. You can see there is a send to option over here. My cursor is hovering over there now for the send to option. I click on the send to option and you can see multiple options available there. One option which I will click is clipboard. Okay, what the PubMed is telling me, these 5 items now have been added to the clipboard. Unfortunately, I had already some 20 items added to the clipboard. So I better empty that before I do this for you. I'll just, I hope I have removed. Okay. I think they have automatically been removed because for 8 hours I had not used this. Okay, so all those have been removed. So now I have these 5 articles. You can see the 5 articles which I searched and I got the good articles from those 5 articles. These 5 articles seem to be quite good articles for my reading. So I can go to now, all these 5 articles, selected articles are there in my clipboard. What I can do now is go to the display options. The format I can change now. Instead of the summary format, I can ask for an abstract format. You can see now all the 5 relevant articles are here And now they are in the abstract format. So it is very easy for me to read all the 5 now. Okay. And any one of them are useful, I will keep them. Any one of them are not useful, I will remove them from the clipboard, right? So like this, out of my articles which I have filtered using only reading title, now I can filter manually by myself, my own reading, by reading the entire abstracts. So how did I do it? First I selected the required articles, I moved them to the clipboard, then I accessed the clipboards, and then from my access clipboard, I went to the display option and I sorted the articles by abstract, right? Now, one more thing. Now that these 5 articles are very useful for you, obviously any article which is closely related to this article will be very useful. So there is one option in PubMed now available. You can see over here. If we go down over here, okay. I am clicking on this now. I got this article now. The first article. And if you go down here, what you can see? Similar articles. Articles which are similar to the first article, right? So if you want to be reading the articles which are similar to the first article, what we would do, we would click on show similar articles. You could also do this. You could go to this references of this article, and if any reference is relevant, you could again search that relevant reference. Okay, you can see show all the 12 references. So what did I do now? What I did was I put all the relevant articles in the clipboard. Now I am going to each of that article. I read the article. Whichever were not useful, I removed them. And out of the remaining articles now, each article now I am going to that article's references and that article's related citations. References are references which are given by that author, right? Those are your 5 references which are given by that author, which are in PubMed. Related citations are similar articles are the articles which are similar to that article as per the PubMed, by a complex matching of the keywords from that article to rest of the articles. It has given articles which are very similar to this article. So any one of these are useful. You can just see the similar articles. You can also see the reference articles. You can also see an article which has cited this article, which has used this article. Okay. So out of this, any one article you find it useful, you could click on that and you could add it to your total number of references. Let us do that now. Let us see the references here. Emergency imaging assessment in deep neck space infections, not so relevant. Complications of space infections in head and neck, maybe not so relevant. Head and neck space infections, then pattern of odontogenic infections in a tertiary hospital. Okay, so whichever you found amongst this is very relevant. You could, let us say, I found the pattern of infections to be very relevant. So what I say, I click on this now and I have opened that article. Okay, this article is related to my first article and I find that this is useful. So what I will do now, I read this article, I send it to my clipboard. My clipboard already had 5 articles. Now I have added one more article which was from the reference of my first article and I have added it to my clipboard. I can access my clipboard now. My clipboard now has the 6 articles. 5 articles which were by regular PubMed search. The 6th article has been added after going through the the reference of the first article. Okay, I could just keep doing this. I'll do it for the 6th one. An insight into acute pericarditis, the need for an evidence-based standard care. I have opened this article now. I will go to similar articles. Let's see similar articles now. Correlation of acute pericarditis and position of mandibular third molar. Predictivity of mandibular third molar and a risk indicator for pericarditis. non-third molar related pericoronitis, surgical removal for mandibular wisdom teeth, osteomyelitis as a result of pericoronitis. So that looks interesting to me. So what I will do, I will click on this article. This article I have got it from the related citations of the 5th article. Now this article is interesting to me. What I will do, I will again use the send to option, you can see, and I have sent it to the clipboard. Now that one more article has been added to the clipboard, my clipboard now has 7 articles. Okay, so this is how you can keep adding good articles to your clipboard and keep improving your search results by manually filtering them. Okay, now that these 7 articles are there, what I would like to do, I would like to save these articles at one place, and let us say I want to show it to my guide, because my idea was to show 7 relevant articles for pericoronitis to my guide, so that my guide will select one article amongst them and give it to me as a journal club. So what I will do, I want to store all these results now. I have saved citations to file, all results as a summary text format. Okay, so I have done that now. You can see now the citations are downloading, these 7 citations. Okay, I'm saving them now. Let me open that. You can see now these 7 citations are there, which are all relevant citations which were there in my clipboard and which I want to be taking to my guide and show to my guide. Now my guide can, since each of these are detailed citations and they are numbered, my guide can select one of these articles and give it to me for journal club. Or my guide can say, okay, let us be more specific. You look up more articles related to metronidazole in the treatment of acute pericoronitis, and then you might just want to explore further over there. So we use now PubMed, the filters and send to options and display options, and we increased the results of our search. So that was my next 6 objectives, next 3 objectives. I will go to the next section now. Whenever you want to search something in the PubMed, the first thing that you would want to do is identify the key terms. Which are the main terms in your search? So that is something which you would want to be doing. So we will see how you can do that. There are 2 more things: use of Boolean operators and use of search tags. So both of these also I will be discussing in this section now. Okay, so we saw this earlier, that your search questions, should be framed in such a way that you have the concepts in your search and not the words. I'll give an example now. Let us say, as an oral medicine PG, you want to know which are the 3D diagnostic tools available in dentistry. We have 2-dimensional tools, which is regular radiography, but you want to be knowing which are the 3D tools available in dental radiography. So if you want to search an article related to that, what are the search terms here? What are the important 3-dimensional diagnostic tools available in dentistry? So out of this search question, what are your search terms? So if I just put like that, the entire question, I'll put that and show you. And this is what a large number of times we do. I copy this entire question. I go to the PubMed. I have put that entire question over there and I asked it to be searched. You can see I just got 2 articles. If you do your search like this, if you put too many terms in your search box, you are going to get results like this. Because what PubMed is going to do, it's going to search for all these words because you have put them there. If that word is there in the article, then only it's going to get it. What are the important? Important is a word. That important word, see, you can see the first article where the important word is there. So it's going to give you articles only if the word important is there, right? So this is not how you want to be searching. You want to be identifying the keywords from your search term. Otherwise, you'll be getting only 2 results like this, right? So what are the key terms in my search result? That's you want to be asking yourself now. So if you ask me, these are the 3 key terms: 3-dimensional, diagnosis, dentistry. Now, if these are my 3 key terms, dentistry is something which I can filter, set up a filter. Now you have to think, how many of them can be set up by filters? How many of them has to be put as keywords? Dentistry is a filter which I can set up. You remember we had a dentistry filter there, dental article filter there. So I don't want to be putting the word dentistry in the search term there. So I will be writing 3-dimensional and diagnosis, and that's all. So let's do that and see. So what are important? I am deleting them. 3-dimensional I am putting. Diagnostic, instead of diagnostic, I am making it as diagnosis. So 3-dimensional diagnosis, I have clicked on search. And dentistry was a filter which I had already put up. You see here, dentistry was a filter which I had already put up by default. I have the default filter available. If you don't want to use that filter available, then I had set up the filter called dental journals. You remember, I had set up this filter. So I clicked on this dental journal filter. Now I have 1764 articles which are related to 3-dimensional diagnosis, and you can see all of them are in dentistry because that was the filter setup. You did not need to put the word dentistry over there. You can see so many articles related to 3-dimensional diagnosis. First article is related to orthodontic. Second one is related to digital, again orthodontics. Third one is related to again orthodontics. Okay, you are a endo PG, you don't like this result, only orthodontics are coming. Now you can further filter by writing. I have now written endodontics. So 3-dimensional diagnosis, endodontics. Now my search results have come down to 122, which is still more. As I told you, don't go for any search result which is more than about 50, 60. It's not very easy for you to search more than 100 articles and get your results. So you probably would like to be having a setup. You want to be setting another filter there. Okay, so like this, your understanding of your search phrase is going to help you in bettering your search result. Okay, so that's one thing which I wanted to tell you. So when you have a term, when you want to search something, at least make it a point to write what is the purpose of my search, which type of article I am hopeful of getting, and which are the key terms in my search. Which of those key terms can be put as a filter? Which of those key terms have to be put in the search box? So once you think about all these things, your search becomes more precise. Then you can play around with what we call as Boolean operators. What are these Boolean operators? They are the terms and, or, not. These are used in capital letters, and whenever you use them to combine your multiple phrases. For example, if you use and, it's going to give an article which has both those terms. If you use or, it's going to give you an article which has either of those terms. If you use not, it's going to remove some term from your search result. Okay, so I'll just show that to you and show the next objective, and then we could close. Okay, so 3-dimensional diagnosis, endodontics. How many results are there? 122. Now I want to know 3-dimensional diagnosis in endodontics. or in periodontics. Okay, I don't want still orthodontics. Okay, I have nothing against department of ortho. Okay, just for an example. Okay, endo and perio are together conducting some, let us say, uh, interdepartmental meeting and interdepartmental presentation. I want articles related to 3D diagnosis from endo or from perio. So you can see what I have done in my search tag over there. I have used and, the Boolean operator. I have used or and nested them. You can see I want articles on 3-dimensional diagnosis on endodontics, but I also want articles on periodontics. Now I have added it and I have clicked on search. Earlier 122 results were there, please remember. Now, okay, it has ignored my nesting, but it has given me articles. Okay, there is some problem there. I should have put a curve bracket. Okay, I am searching now again. Okay, earlier you remember 122 results were there. Now what is there? 221 results, and they are all related to 3-dimensional diagnosis because and has been put over here, and they are either from endodontics or from periodontics. 3D diagnosis related to endodontics, 3D diagnosis related to periodontics. Okay. Now, if you see a lot of endodontic articles are there, not so much of periodontic articles are coming up over here, then you might want to just remove this endodontic and just keep periodontic and search. Now you have 131 results related to now articles related to periodontics, and you can see they are all related to 3-dimensional imaging. Right now, we will go back to our earlier search term of post and core, just to demonstrate to you one more thing. Okay, now our earlier search result of post and core, we have seen that some of the results were not relevant, right? I'm just trying to get that non-relevant article. I think we had set up a filter at that time. That's why we had that article. Okay, I'll just clear all the filters. Okay. Okay, now we have these 17,649 articles. Some of these articles have the term post and core in the title itself, right? Most of them, you can see, most of them have the term post and core in the title itself, but some of them may not have. Okay, so if you want to specifically say this particular term post and core should be there in the title, we have an option available there. This is a search tag. Out of these 17,000 articles, I want the term post and core in the title itself. If it is there in the title, then it will be a main theme, right? So what I have given here now, a search tag called TI. A search with a search tag of TI, you can have 311 results are there. Out of the 1700 results, there are 300 results, and all these 300 results now, I can be very confident that the word post and the word core is there in the title. You can go to any number. This is the 40th article. It has the word core, post and core in the title. This is 50th article. It has the word post and core in the title. So wait till the 300th reference. Each of this reference will definitely have the term post and core in the title. Why? Because I have now given a search tag. This is not a filter. I have added a search tag called title search tag. So it's going to give me only articles that have that particular term in the title. Okay. Other than the title, you can have multiple search tags. Okay, you can have a search tag for an author, search tag for a title, which we saw. If you, instead of writing TI, if you write TIAB, that will be the search tag for that word in title or abstract. And other search tags are important, which are mesh search tags, which I am going to probably talk about tomorrow. So that was all for today. We have seen the simple basics of PubMed search. We have seen how we can set up the filters. We saw how display options are searched. We saw how send to options are done. So each of this, I hope you will explore. You will set up your own MyNCBI username and a password, and you will do all these things and come back tomorrow. And also I expect that you just use the clipboard, also use the advanced search, which I have not talked about today, but I would urge you just go to advanced search and see what that is. Okay, try to explore it. And also I would ask you to go to the user guide of PubMed, which is available over here right hand corner. Please go to the user guide of the PubMed, and also have an idea of what are all the things which we have discussed, what things are still not known to you. Just have a look at where you stand in relation to PubMed search. And when we come back tomorrow, then we will have a lot of discussions, and we will have some question answer sessions. So that's all for today. We can have some questions, or if it is like time is not available, then we could close the session. Over to you, ma'am.
Yeah. Any questions from anybody? I don't see any questions coming up. I think we'll wind up for today and we'll meet tomorrow at 12. Is that okay with you?
Yes, ma'am.
Okay, thank you so much.
So in
Thank
case,
yes.
I just display my mail ID.
Yes.
In case anyone wants to ask a question, if I find it relevant and interesting, I'll pick it up tomorrow. This is my mail ID. In case you want to send me a question, you can send it. If it is interesting and relevant, I'll pick it up tomorrow.
Okay, I think we should wind up now. Okay. Thank you very much, Dr. Ravi. We'll meet tomorrow at 12 noon tomorrow.
Sure.
Thank you very much.
Welcome.